A team of medical specialists has been traversing rural Limpopo for the past month as part of the Rural Health Matters campaign to help with the surgery backlog caused by COVID-19. A team of medical specialists will be rendering services at hospitals in the Vembe district until Sunday, the 29th of November. Joining us now for more on this is Limpopo Health MEC Dr. Phophi Ramathuba. Dr. Ramathuba, thank you so much for your time tonight. Certainly, COVID-19 has not only wreaked havoc on the streets as people are now social distancing and not even able to mingle, but also to their health. But certainly the backlog in the system appears to also be piling up. How bad was the situation?
Evening, Bongiwe, and all the viewers there. What we can indicate is that as a rural province, which historically has never had the luxury of medical specialists, we had just appointed quite a number of specialists. But remember, when I was appointed, our specialists would not even come to a number of 20. So today, we can proud to speak of specialists that are over 150 plus 200. But now, the challenge of COVID is that while we have made this a progress of getting a number of specialists when they were in the process of trying to clear the backlog, then we find ourselves under level 5 lockdown, which resulted in a number of elective procedures having to be postponed. But of course, as a province, we have to be innovative and come up with ways on how we can be able to provide that healthcare services, especially to the rural workforce. Majority of our people, actually 91% of the population in Limpopo prior COVID-19 were dependent on the public healthcare. Only less than 9% were able to afford private health. Now with the COVID, and some people losing their jobs, meaning they also lose that medical insurance, they will therefore depend on the sector. It means the statistics post-COVID will be different and will be more than. Now, what we have done with our rural health measures project is to take along our volunteer medical. They are not only from the Limpopo. Some, for instance, we were with Professor, the head of the clinical department at VET, the general surgeon, who since Monday, he has been volunteering his services at Children and Siloam Hospital, where they managed to do a lot of surgical procedures, including thyroidectomies. They've been able to repair a number of hernias. And that assists there are many benefits of this particular project. One, you get a professor having a feel on how it is for a poor medical officer working in that rural area without the support. Secondly, the professor is able to teach and transfer his skills, and some of the procedures, even if he has left, will still be done in that hospital because, for instance, if he has been able to do just in 3 days' time, 15 thyroidectomies, so the medical officer that he was working with will be able to, moving forward, be able to perform such procedures. So the third issue here is that Petersburg and Mankweng has got very few theaters. When we appoint more specialists, it means they will be competing and fighting for those theaters. Now, let me give an example, Bongiwe. If you have booked an elective for you to want to do an or a fixing of a bone, and then there is a gun, a short wound that comes, or you have to postpone that and focus on this one, which is an emergency. So that also continues to perpetuate the backlog. So now, when you are utilizing theaters in the rural hospitals, there is no competition. All what we did is that we have got around 50 specialists this time around. When we started in Spukune district, we were only 13 to 15. And then when we went to Mupani district, we were around 38. This time around in Vembe, 50 specialists has responded. Like I've said, they are coming from all over the country. And when we get there, we divide ourselves to say the general surgeons will be in Childini, the gynae and obstetricians will also be in Malamulele Hospital. Then we have a plastic and reconstructive surgeons. You have seen what they've done to the old lady. They were in Donald Fraser Hospital, and the ENT surgeons were in Elim Hospital. They are using the very rural hospital. They are using the very minimal resources that we're having. But if you look at the procedures that they've done really wonders. Just today, when I count all these, I'm talking about the long procedures. They've done around 97 of them. So we are still continuing tomorrow, which is Saturday, with a number of orthopedic cases, and again Sunday. So I can tell you, by Monday, we would have done more than 200 to 300 procedures.
All right. Thank you so much for your time tonight. We certainly do appreciate it. That's Dr. Phophi Ramathuba, who is the Health MEC there in Limpopo.